So I'll be saying why weight should be the focus of diabetes management in India. So I'll give you 10 reasons why the answer is yes. So when we look at the pathophysiology of type 2 diabetes, obesity is at the center of it all. Adipokines released by the adipose tissue are central in the control of glucose homeostasis. We have pro-inflammatory cytokines in the pathogenesis of many complications of type 2 diabetes. We know that obesity is responsible for cardiovascular disease burden in diabetes and also the various complications of diabetes like MASLD or the microvascular. So obesity does have a definite impact on diabetes and its complications. And in India, the Asian Indian phenotype, we know that we do have the thin fat Indian phenotype. Here we are not only talking about BMI, but we also have fat percentage, which is important. So even when we are looking at individuals with a lower BMI, fat percentage is important. Even here, obesity or adiposity plays a major role in the pathogenesis. So when we're looking at tracing the reverse route from cure to cause pathogenesis of type 2 diabetes, obesity is at the center of it. And if you want to treat diabetes in a holistic way or cure diabetes in a holistic way, you should be treating obesity at the center of it. So number 2 reason why obesity should be at the center of management in diabetes is 88% of people living with diabetes have obesity. When you look at number 3 reason, we have remission evidence from the direct trial. So you know that structured weight loss of more than or equal to 15 kgs achieved remission as much as 46% at 1 year versus 4% in controls. And this was maintained in 1/3 of the individuals at even 2 years. So in type 2 diabetes, managing weight is managing the disease itself. So this was quoted by Dr. Roy Taylor, who is the main investigator in the direct trial. And number 4 reason why weight should be at the center of your diabetes management is there is an effect of weight loss on medications. Weight loss reduces insulin and sulfonylurea requirements, lowering hypoglycemia risk in diabetes. Weight loss has microvascular benefits. Weight loss improves albuminuria, slows kidney disease, and reduces MASLD progression. It has benefits on the macrovascular complications as well. We know that bariatric surgery with sustained weight loss reduces MI, stroke, and mortality. And this has been shown to you in many talks that there are cardiovascular health benefits resulting from weight loss. It has its effect on a number of manifestations, like you can take heart failure, you can take CV mortality, NASH, cardiovascular disease. There is a definite benefit on all of this. So reason number 7, weight loss in lean individuals is also beneficial because lifestyle intervention reduces diabetes incidence even among those with lower BMI. Reason number 8, lifestyle medications advocating a modest weight loss of 3 to 5% are recommended even for lean individuals with MASLD, and this is already in the American gastroenterology guidelines, which were published in 2022. And what do the diabetes guidelines say? So weight loss is the cornerstone of diabetes management in people with overweight or obesity, and that's 88% of our population. And even in the rest 12%, we do see that weight loss is definitely beneficial in diabetes and its complication. So this is the ADA Standards of Care 2025. You can see that obesity is right up there. The algorithm looks at whether your patient has obesity or CKD or heart failure. So that's a very important consideration when you think of which tablet should you choose for your patient with diabetes. ACE guidelines also say the same thing. In fact, it starts with BMI right high up there. You can see that the step 1 is to assess BMI. So, obesity is the first step in management of diabetes. So just to summarize, weight should be the focus of diabetes management in India because obesity is at the center of pathophysiology of diabetes. 88% of our people living with diabetes have obesity. Remission of diabetes is linked to weight management, benefit of weight loss medications. We have benefit of weight loss on macrovascular complications and microvascular complications. There is benefit of weight loss in thin fat obesity. There's benefit of weight loss on comorbidities in thin fat obesity. And all the guidelines The number 9 point is, even all the guidelines say that obesity should be at the center of your management in type 2 diabetes. So coming to the 10th and the most important point, why weight should be the focus of diabetes management in India. Because Dr. Supratik says weight should be the focus of diabetes management in India. In fact, this was a tri-bait a couple of months ago where Dr. Supratik was speaking for weight loss in diabetes. And thank you for your attention.